I was asked to speak today about pragmatic challenges of engaging stakeholders in pragmatic research trials. And this comes, I don't have any commercial conflicts to disclose, but I do receive part of my salary support from the Data Science to Patient Value program and co-lead the Dissemination, Implementation, Communication, and Engagement Core. Um, I think the main thing I wanted to say in terms of a disclaimer before I start is that I have a longstanding interest in both the promise of and the challenges of democratic decision making, and in particular, the issue of deliberative democratic decision making, which is to say, what happens when you can't just pull a bunch of people together and have them vote on something without first giving them the opportunity to learn about it, to talk about it, to learn the nuances. So there are a number of things in society where we can just vote and people sort of know already what they think. They know enough about the issue that they could vote on it. But a lot of the work that we do in science is considerably more nuanced and challenging than that. And as a consequence, people really need to learn about it. And of course, this is a well-recognized problem in democracy, as Winston Churchill said, um, democracy is the worst form of government, except all those other forms that have been tried from time to time. This is essentially a reflection on the fact that democracy, as we all experience this in the real world, not just in research, but democratic decision making is prone to sort of mass effects and the idea that people get to vote even though they don't really understand sometimes very well some of the issues that they're voting on. So I'm going to do the following, which are the learning objectives that we laid out for this session. I'll speak a little about some of the key terms, and we'll talk about some of the concepts related to stakeholder engagement along the way. And then we'll talk about some of the purposes and value and the evidence for using stakeholder engagement. And I'll try and tailor this a little bit to the idea of using stakeholder engagement for for informing pragmatic research. And along the way as well, I'm going to talk about some of the ethical considerations, and I'll really end with what I think of as some of the more provocative challenges that are faced by people trying to engage stakeholders in pragmatic trials or in pragmatic research more generally. Quick background on the Data Science to Patient Value program. Big data is the peanut butter, and it's surrounded by this concern that it be used to generate value. And the D2V program really has the following as its sort of mantra. We're trying to create this big data research environment at CU that will be multidisciplinary, collaborative, will engage computational work, but will also include a specific focus on implementation and the ethics of this work, because it needs to be applied within the real world. And so the issue of stakeholder engagement was important right from the outset of the Data Science to Patient Value program. And for that, I do want to give credit to Gene Kuttner and Lisa Schilling and Mike Ho and Michael Kahn, the originators of the D2V program, who saw right from the beginning the importance of stakeholder engagement as a specific focus within this data science environment. And there were at least three reasons for this. Number one is that complex ethical and policy issues are actually common in big data research. They're also common in all kinds of pragmatic trials, not just things that feed off of big data. And this has been evidenced by a number of high profile sort of what you might call missteps within the big data arena. I'm sure many of you will remember the man in, I think it was Milwaukee, whose daughter became pregnant, and he learned that she was pregnant because the store Target had been doing analysis on their customer base, and they realized there were patterns that suggested someone might be pregnant, and so they start sending her pregnancy-related flyers, and this set of sort of problems related to bias in big data sets or inappropriate uses of big data have been sort of front and center from the outset. And what that means is that there's been a lot of demand for community engaged research in the big data arena, but also in pragmatic trials, and yet relatively little guidance on what exactly it means to do community engaged research or how specifically to do it. So, so those are sort of the top level. And then the third thing is, if we actually want our work to have real world impact, then we're going to need to bring other stakeholders into the research that we do in the health sciences. We have a definition of stakeholder and a definition of engagement that we adapted essentially from Concannon, who's worked with PCORI on their stakeholder engagement framework. And there, you'll see, if you're familiar with the Concannon framework, you'll see some subtle differences here. Maybe the most important ones are, like PCORI, we aren't just talking about community engagement when we talk about stakeholder engagement. So patients and communities are key stakeholders to the type of work that we do. But in addition, there are clinicians, there are leaders of health systems, there are policymakers, and so on. And then in terms of engagement, we've essentially excluded some things that some people would call engagement by requiring that the engagement that we're looking at be longitudinal and at least bidirectional, if not multi-directional. And the idea here is that merely putting out information about your program or using recruit people to your research doesn't actually count as engagement within the framework that we're using. And there are a number of reasons for this that we'll get to in just a second. This is the rubric that PCORI uses to think about engagement. And there's a sort of So this is PCORI's rubric for engagement. And within this rubric, there's a sort of implied way of thinking about engagement, which is that engagement can be organized according to the phase of the research protocol. So this starts with planning the study and ways of and ideas to engage people, conducting the study, ways to think about that, and dissemination of study results. And of course, you could think other of the research of the engagement protocol. So the idea here is that engagement can be organized in a couple of different ways. One way to organize stakeholder engagement is by thinking about who are the stakeholders that you need to be involved in your research process. Is it patients? Is it other researchers? Is it purchasers? Is it industry? Is it training institutions, and so on? And there are a lot of different frameworks for thinking about this. I'm not going to go through these, but just to say that within the business environment, this is often stratified by sort of level of interest, the extent to which they're going to want to spend their time and energy involved in your research project. The other way is by task, and that's how the Precori rubric sort of organizes things, is why are you engaging people? Is it for planning or conduct or dissemination? Is it for a more specific purpose? Do you want help with developing questions? Do you need to build trust within the local community that you're doing the research with? Is it about recruitment? Is it about targeting of the research to the right audience? Is it about being more efficient? Is it about fundraising? As there are many ways in which you might decide to pursue an engagement strategy. And it's really important to be clear at the outset, not only about who are you trying to engage, but why are you trying to engage them. If you aren't clear yourself about why you are bringing people into the process, it's very likely that you won't get there. And it's actually possible that you end up alienating people because we'll come back to this in a moment, but you may have started the process with your why not matching up with the why of the stakeholder that you're trying to engage. You've undoubtedly, many of you, seen this engagement continuum. This is another way of thinking about or organizing your framework of engagement, which is essentially about the extent to which you're trying to bring people into this process, and are you trying to bring them on as full participants in a collaborative environment where they're co-creating a democratic process where they're literally voting on things? Or at the other end of things, are you just trying to make sure people are aware of what you're doing? And they may or may not ever reach out to you to tell you that they like or don't like what you're doing, but you feel like it's important for them to be aware. At both of those extremes are possible. Sometimes one is really more important or relevant or appropriate than the other. So the last thing I want to mention is that you could also organize stakeholder engagement by method. How is it that you plan to engage? And I'm not going to go into this in detail because you'll be hearing more about the various engagement methods and the sort of pros and cons of different engagement methods and how to select methods in some of the other presentations. But I will just say that this is probably the area where there is the least in the way of specific guidance that's already out there and available. Pecori says that it's important to engage people in ways that are appropriate and necessary in a given research context, but without specifying what is appropriate, when is it necessary, and what are the methods that are appropriate and necessary given specific research contexts. So I think that's a ripe area for research and future scholarship. There is a sort of traditional approach to selecting a stakeholder method, which I alluded to earlier in business, and it has to do with, what's the level of influence, what's the level of interest, and which of these levels of engagement matches up with the stakeholders' level of interest and pre-existing engagement and their influence on the process. And there are multiple benefits of meaningful stakeholder engagement. I'm not going to talk in detail about this. I think others will be speaking about some of the sort of projects that have been done and what the benefits have been. There's a wonderful, I put the link here, webinar from a couple of people from the Pecori project, Christy Graves at Georgetown and others, who talk about their experiences and sort of what are the benefits that they have derived from stakeholder engagement in their process. In the business world, you can find a variety of sort of lists of the various benefits that come out of effective stakeholder engagement. And this is also from that Pecori presentation about benefits to researchers. And they also talk about what are the benefits to the community. I think these are all incredibly important to understand these benefits, because it may be that one of your aims is to really capitalize on one or more of these particular benefits. But this would be sort of its whole presentation. And instead, I want to spend a few minutes here talking about what I said I would talk about, which is what are the challenges in pursuing meaningful stakeholder engagement. There are a number of these that are, I'm going to call them less controversial. Because these are really well-recognized challenges that if you do stakeholder engaged research of any type, or if you talk to people who've been engaged in this kind of work, they will all recognize these as being practical challenges in carrying out meaningful stakeholder engaged research. And I'll start with the fact that you have to recognize that there are power dynamics in play, and it is not automatic that you will create a respectful, culturally appropriate environment in which people can be open and willing to share what they know and what they're learning and what they don't know, what they want to learn more about. And that practical issue of getting people to the room, creating an environment in which people feel like they can speak openly and share what they know. That is a widely recognized issue, and I'm I'm embarrassed to not have half a dozen slides on this, but I feel like this is such a well-recognized issue that most of you will probably already have got some experience and some thoughts about what it is that you can do to try and create an environment in which people can be trusted and trusting. Um, the other thing that I think is widely recognized is that people will come to, and especially if you're talking about stakeholders in the broader sense, so not just patients and community members, but also clinicians and clinical leaders and policymakers. Those people will come into a research environment with really very differing backgrounds in terms of their understanding of, what it takes to do research, what are the limitations, how difficult it is to obtain funding for research. The fact that you can spend months on a project and then have the funding not materialize, and you just have to move on to another project sometimes. So people who don't do research all the time, or who don't work in health systems all the time, or with health insurance plans, or with clinical practice groups. There are different ways of understanding and levels of understanding of these things, and those have to be taken into account, especially in terms of the time that it takes to bring people to a level playing field where you can actually have a productive conversation because you share the same vocabulary, you share an understanding of what it is that you're trying to accomplish and the challenges that you're going to face. And the next thing, the fourth thing that I want to say, which is I think a very well recognized issue, is that when you bring people into the process who are not researchers, it is very likely, whether they are patients or leaders of a clinical practice, or a policymaker for that matter, that the issues you're doing research on are not abstract. They are often very personal. And of course, that can be true for a researcher as well. There are plenty of people who do research on diabetes and they have experience with diabetes in their own lives. There are plenty of people who do research on asthma and have experience with asthma in their own lives, right? So I'm not saying this can't happen with people who are sort of entrenched in research. But when you're bringing people in who don't do research all the time, the task of doing research in a sort of removed way of trying to say, look, we need to get the answer to this, and I know what answer I would like to have, but that answer might be wrong. That is more difficult if you aren't within the culture of research. It's difficult enough within the culture of research, but when you're bringing people in who are from outside the culture of research, this idea of taking something that is deeply personal and abstracting it to a research protocol and a research question are very challenging. And this actually gets me to what I think of as the more provocative challenges in terms of accomplishing meaningful stakeholder engagement. And I'll just put these up all at once, but let's talk about each of them for just a moment. In research ethics, one of the things we care about a lot is that people not go into a research protocol believing that they are receiving therapy and understanding that they are part of a research protocol, and we don't know yet whether treatment A is better than treatment B. If we already knew that treatment A is better than treatment B, that would be an unethical experiment, right? You can't randomize people to experience something that you know to be inferior to whatever it is that you're trying. So this notion of mistaking a research protocol for a therapeutic protocol is very important when it comes to the informed consent process in research. And in pragmatic trials, there is already an amplified risk of the therapeutic misconception coming into play, because pragmatic trials tend to be rather late in the process, where you already have some data suggesting that what you want to do is effective. And so both for the researcher and for the stakeholders who are engaged in developing the research process, or interpreting the research data, or disseminating the results, there is very much the possibility, and sort of amplified possibility, of a therapeutic misconception, and that people don't realize that if you already knew this worked, you wouldn't be able to do research on it. And the reason we're doing this is to find out whether it works or not. So, so the therapeutic misconception plays out in a couple different ways. One is around the amplification of internal and external validity trade-offs. And when you're doing pragmatic research, you're already looking at trade-offs between internal validity and external validity, right? You tend to look more towards external validity, and is this going to work in the real world? And in the context of doing that, you may lose some of the internal validity. But if you're doing a pragmatic trial at 12 different sites, and you want this to be successful at every site, and you want it so much to be successful at every site that you give them all the flexibility in the world to try and figure out how to make it successful, you may not actually be doing research anymore. Now you may be doing quality improvement, but you've sort of moved, and there's a gray space here between quality improvement and quality improvement research and clinical pragmatic trials. But those trade-offs should at least be made in an intentional way. The other way in which the therapeutic misconception often plays out is the inherent tension between research and advocacy. If you bring into your research protocol and your stakeholder engagement process someone from an advocacy group, and many people think of themselves and are advocates for people with their condition, or for a variety of things, but once you have someone on board who is explicitly an advocate, there is going to be some level of tension between the advocate, who already kind of knows what they want and knows the outcome that they're aiming to achieve, and the researcher, who, at least in theory, isn't sure yet. That's why they're doing the research. And that tension between research and advocacy can play out in a variety of different ways. And again, it's not bad. And there are many advocates that I've worked with. Many of you will have worked with advocates who are incredibly useful, incredibly productive, and open to learning that what they have been advocating for may need to be tweaked, or may even be wrong, and they need to take a different approach. So it's not to say that people who are in the advocacy role are closed-minded. They are not always closed-minded. They're often very open-minded. but there needs to be an open acknowledgement, I think, of the potential for tension between um, research and the advocacy mindset. The next sort of provocative issue is what I call the myth of finding a representative. And the idea here is that you will bring someone in from a community, and that person is supposed to be the representative for that community. And I'll start by saying that's unfair. That's unfair for that individual to be expected to represent an entire community, which typically will be quite heterogeneous. And this individual may or may not feel that they are capable of being the representative. And by the way, if they do feel capable of being the representative for a very large and heterogeneous community, they're probably already an advocate. Which brings me, back to that prior one. There is a difference, and again, this will be intuitive to many people listening to this, but there is a difference between a regular member of the community, an average member of the community, if you will, and an advocate within that community. The advocate often will know a lot more about the issue, the condition, but the advocate also will have become, to some extent, entrenched. The advocate will, to some extent, have become educated and aware. The advocate may have a different mindset because of their advocacy work than an average person from within that community. So this actually blends now these last two provocative issues. One is that do not be confused that by having a person from a community that you have found a representative who now sits on your stakeholder engagement panel or is involved in your focus group or whatever the activity is, and that they fully represent all of the variability within that group. And this last one, which is as people become engaged in the research process, there is an inevitable evolution that takes place in the way that they think about research, in the way that they think about the process, and even potentially in the way that they think about their condition. There was a wonderful essay about this by a young woman who has type 1 diabetes. And she said, the first time I became involved in research, I was a teenager, and I had relatively little time since I had been diagnosed. And I was able to do things then as a community, as a patient stakeholder that I actually cannot do anymore because now I'm 10 years on. I've been involved in multiple research projects as a community or a patient stakeholder. And by the way, I have a PhD now. So what I could talk about now are different things than what I could talk about when I was a newly diagnosed patient. So if you ask me now, what was confusing to you when you first heard about this, I have a hard time remembering that because I've had this condition for so long and I know so much about it. The vocabulary is my vocabulary now. And it's hard for me to remember what words were confusing to me when we first got started. So there's an inevitable evolution that takes place as people become engaged in the research process. And at minimum, the researcher and hopefully also the individual is aware enough of that to realize that there are different tasks that people can do better or worse as they become a part of this process. So let me end with a few approaches to addressing these challenges. And first, these are approaches that I think are to address the challenges I sort of put up top, the widely agreed issues. These are practical issues. You need to have accessibility of the space. You need meetings to be at the right time. There are language issues that often need to be addressed. Questions about compensation of individuals, especially when you're talking about patients or members of the local community. issues being attuned to power dynamics, not having too many, professionals in the room, because that will tend to squelch conversation. Who's going to lead the meeting? Having one of the community members lead a meeting is a frequent sort of strategy for allowing people to really engage. How many numbers do you want to have in the room at one time? So I think if you go back to the slide deck that I mentioned earlier from that Picori presentation, you'll get a lot of ideas that are very practical about how to create an environment in which people are trusted and can become trusting. In terms of these more challenging or more provocative issues, these are just ideas because I don't think there is a way to address these. I think in some senses they just have to be acknowledged and recognized as issues that are inherent to the stakeholder engagement process. So for example, the fact is a study protocol as it is being developed and implemented and disseminated may have a variety of aims. Some of those aims may in fact be in conflict with other aims. And being clear about the priority, like, how important is it that you keep the protocol stringently applied at every site? And how much are you going to allow flexibility before you lose the capacity to actually say, here's what worked, and maybe here's what didn't work? And that needs to be an explicit conversation with the stakeholders who are engaged in the work so that it is at least clear that you are making these trade-offs. And so keeping an open mind on both sides, by the way, right? So this is not just something researchers need to do. This is also something that community members, other stakeholders, clinical practice leadership, the fact that research entails the balancing of different priorities and aims is critical for everyone to acknowledge and be open about when you are making those trade-offs. The idea that people come to the table with different amounts of background knowledge also means that you really have to allocate enough administrative support and time for people to learn how to learn from and to teach each other. Repetition will be needed. And so patience and humility as people work their way through these processes is very important. And this is why, by the way, within our definition of stakeholder engagement in the Data Science to Patient Value program, we so much emphasize the idea that longitudinal involvement is critical to working your way through these other more challenging practical issues in stakeholder engagement. So I will end there, and I believe that we go to question and answer now.